Welcome to Module 18. In this section of the course, we are going to discuss documentation, incident reports, and professional boundaries that are related to medical concerns and emergency situations in behavioral health settings. So after an emergency or a first aid situation happens, a lot of people feel emotionally relieved once the immediate crisis has passed. But professional responsibilities often continue even after the event happens itself. So counselors may need to complete some documentation, notify some supervisors, file incident reports. Maybe we need to follow workplace procedures and maintain appropriate professional boundaries during any follow-up interventions. Good documentation is going to serve several different purposes here. It's going to help support the continuity of care. It's also going to communicate important information, protect client safety, demonstrate professional responses, and reduce legal or ethical concerns or confusion later on. So in this module, we're going to be focusing on objective documentation practices, incident reporting basics, maintaining professionalism, boundary considerations, and avoiding common documentation mistakes. One important reminder is that documentation should never become emotional storytelling or a personal opinion. Professional documentation needs to remain factual and objective. We need to be clear and behavior focused in our documentation. The goal is accuracy and professionalism and ethical responsibility. So documentation is really an important part of professional behavioral health practice because accurate record keeping helps communicate important information. It's going to support that continuity of care and clarify what happened when we are finished with whatever we did. And then we're demonstrating appropriate counselor responses there. So if there's an emergency or a first aid situation, documenting later becomes important because they may need it for medical follow-ups or legal reviews or insurance purposes or workplace investigations, quality assurance investigations, whatever. And poor documentation is going to create confusion and is going to increase the liability concerns for yourself and for the company. And then at the same time, overly emotional or judgmental documentation is going to create problems too. So your professional documentation needs to just focus on observable facts and like what actions did you take? What were the client responses to those? And just use objective descriptions of the situation, not subjective, because the good documentation is going to protect both the counselor and the client. And then following a medical concern or an emergency situation, counselors need to document some important objective details here. So any observable symptoms, any client statements that were made, any actions that were taken, any emergency services that were contacted, were there any referrals provided, any relevant timeframes. Basically, the documentation needs to focus on what was directly observed rather than your assumptions or your interpretations of the event. So, for example, I might say like, client appeared pale and dizzy and briefly lost consciousness. That's more appropriate than client was being dramatic and passed out. So professional documentation is going to avoid the emotional language and the personal opinions. And it's also important to document any supervisor notification, any emergency response activation, any follow-up instructions or referrals that you provided. That clear documentation is going to improve the communication and the accountability. And one of the most important documentation skills is understanding the difference between objective and subjective language. Objective documentation describes what did you observe, observable behaviors, direct statements, what were the physical symptoms, what were the factual events. It happened at this date, at this location, at this time. And they said this, right? That's observable. Subjective documentation, that's going to be like your personal opinion. Client was dramatic. Assumptions, emotional interpretations of it, judgmental language. So, for example, client was slurring speech and unable to maintain balance. That's objective. I can see that. But client was obviously intoxicated and out of control. That's subjective. That's my opinion. That's an interpretation. It is emotionally loaded wording. So professional documentation is going to remain calm, factual, specific, and behavior focused. And that's really important because a lot of records are going to later be reviewed by supervisors or attorneys or medical providers or courts or licensing boards or insurance agencies. And that professional language is going to protect both you and the client. And a lot of agencies are going to require incident reporting following any emergency or injury or any unusual situation. So an incident report that typically is separate from routine clinical notes because they're designed to document specific events that involve like safety concerns or injuries or medical emergencies, aggressive behavior, property damage, emergency response activation. All of these are going to be incident report worthy. And so we need to know what the workplace procedures are regarding when reports are required, who should be notified, how reports should be submitted. An incident report should remain factual and professional. We want to avoid blaming anybody, no sarcasm, no emotional reactions, no speculation. The goal is just to document what happened clearly and accurately, and we're not assigning punishment or expressing frustration about it. This is just what happened there. And then prompt reporting is also important because memory becomes less reliable over time. And confidentiality is also important even during emergencies and incident reporting situations. We only need to share information with the appropriate medical personnel, supervisors, emergency responders, or authorized individuals according to your legal or your workplace requirements. And it's also important to avoid discussing client emergencies casually with any coworkers, friends, family members, unrelated staff, whatever. The clients already are going to feel vulnerable or embarrassed or frightened after a medical incident. And so we want to protect their dignity. And we also need to, their privacy is going to remain an important professional responsibility here. We want to avoid the gossip. We don't want to be emotionally dramatic, retelling the story. Professionalism includes handling sensitive situations respectfully during and after the event. Emergencies can sometimes blur professional boundaries because counselors naturally want to help the clients who are distressed or vulnerable, but it's important to maintain appropriate professional roles even when we're in crisis situations. So we need to avoid acting outside of our training. We don't want to make promises that we can't keep. We don't want to be emotionally over-involved, or we don't want to attempt any advanced medical interventions beyond what we're qualified to do. These professional boundaries are going to help keep us, protect both us and the client. And it's going to maintain a calm and structured and appropriate support. And that's more helpful than just trying to rescue the client emotionally or medically. We need to remember that we collaborate with medical providers and emergency responders and supervisors and other professionals. It's part of our ethical practice. And so medical emergencies and crisis situations often affect counselors emotionally. Like after difficult incidents happen, you as a clinician you might feel anxiety or guilt or fear or emotionally exhausted, frustrated. You may be replaying that event mentally over and over afterward. And these reactions are normal human responses to stressful situations. We don't want to ignore the emotional stress and assume that we have to handle everything alone, because we don't. Supervision, consultation, peer support, self-care, these are all part of professional functioning. And ignoring emotional reactions over time can lead to burnout or compassion fatigue. We become emotionally detached, or worst case scenario, it's going to decrease our effectiveness as clinicians. So professional self-awareness is an important part of our ethical practice. And there's a lot of common documentation mistakes counselors need to avoid. One is using those judgmental wordings, exaggerating events, guessing diagnosis. Don't include your personal opinions. Don't delay documenting, right? Because something could happen, and I've seen it happen where, the clinician handled an emergency situation and it was towards the end of the day and like, I'll document it tomorrow. Client went home and committed suicide that night. You have to document as quickly as possible. Don't leave out any important details. Another common mistake is documenting emotionally rather than objectively. So saying like, client caused chaos and refused to cooperate. That sounds emotional. It's very vague. We want more objective wording. What did they do? What was the observable behavior? What did they say? What actions did you take? So we need our professional documentation, it needs to stay specific and factual and organized. We want to stay behavior focused. That clear documentation improves communication and it reduces the confusion later. And we want to stay professional during emergencies, but that goes beyond the immediate crisis itself. So we need to continue to prioritize ethical behavior, respectful communication, accurate documentation, and the client dignity through the follow-up process. Even stressful situations need to be handled without gossiping or ridiculing or shaming someone or, being emotionally overreactive, because the clients remember how we treat them during these vulnerable moments. And so when we remain calm and respectful and organized and ethically grounded, it's going to help create safer, more trustworthy environments for our clients. Our professionalism is often most visible during these stressful situations. So as we are closing this course, I just want you to remember that HIV education, first aid awareness, ethical professionalism, and stigma reduction are all closely connected with behavioral health work. So counselors don't need to become medical experts in order to respond effectively and professionally. But we do need to understand basic HIV knowledge, transmission realities, prevention strategies, emergency awareness, first aid principles. What are our documentation responsibilities? And the importance of emotional safety and professionalism. So throughout this training, I've emphasized calm responses, factual education, respectful communication, cultural humility, and maintaining our professional boundaries. And clients are more likely to seek help and remain engaged in treatment and access healthcare when they feel emotionally safe and respected. So I want to thank you for participating in this HIV, AIDS, and first aid training course. I want you to, next you'll proceed to the final assessment. You must receive a 70% or higher to pass, and you can take it as many times as you want. If you're having difficulty finding the certificate, you may need to go out after you've passed the quiz and then go back in.